Good day everyone, I am Crisantahero Caparas from DSN1 11G, and so for today I am going to perform a proper return demonstration about the assessment of the abdomen. But first I am going to review the client's previous medical records and doctor's order sheet if available. Then I am going to determine the scope of assessment needed, then prepare the necessary equipment that we are going to use during the assessment. The first equipment is the stethoscope, the marker, pencil, notepad, surgical gloves, and also the comprehensive form. Hello sir, good afternoon. I am Crisantahero Caparas, your student nurse. May I know your full name please?
I'm Jason.
Okay, so when is your birthday sir?
Jason.
How would you like me to call you po? Okay sir Jason, which language do you prefer me to use? English or Bisaya? Okay, so it is important to establish a good rapport with the client. Then I am going to explain the procedure to the client. So sir, the procedure that I'll be doing is to assess for your abdomen. This is done to determine whether these are any abnormalities in your abdomen. And I'm going to touch some parts of your body, and there are certain procedures that you need to follow. Is this okay with you sir?
Yes.
Okay, thank you sir. So are there any clarifications or questions before we proceed to the procedure?
No.
Okay, so since I already closed the doors and fixed all the curtains and adjust the room temperature for my clients and comfort privacy. Okay, so sir, have you urinated already?
Yes.
Okay, so sir, I am going to ask you some questions. So sir, do you feel any pain in your stomach, or are you uncomfortable right now?
No.
So, do you have any health history such as incidence of abdominal pain and constipation?
No.
So, do you have any experience in a change in appetite?
No.
So, what did you ingest or what did you eat last week?
Salad.
And now I am going to proceed to surveying the abdomen. Position of the client is a supine position. Cover the upper and lower body parts with a bed sheet, leaving the abdomen exposed. Then observe the abdominal skin. Note for any vascularities, visible dilated veins, or spider veins. Note for any stretch marks. Then assess for scars, lesions, and rashes. Note the history of scars and document its location by quadrant, reference, and reference line. So as I can see that your skin is intact. So next is I am going to inspect for the umbilicus for its color, contour, and location. So as I can see that the color of your abdomen is also good. Now I am going to inspect for the contour, round, flat, or the skin. While the client lies flat or with supine on the bed, sit beside the client, look across the abdomen at a level slightly higher than the client's abdomen. Okay, so now I am going to inspect for the abdominal grid. Inspect the area in between the lower ribs and pubic bone and note for any abdominal enlargement. Okay, so now I am going to measure the abdominal grid using a measuring tape, and at the same time of the day and in the morning. Ensure that the client has emptied his or her bladder. The position of the client is a standing or a supine position. The client's head may be slightly elevated for orthopneic patients. Then use a disposable, easily clean tape measure if tape measure is not available. Use a strip of cloths or gauze, then measure the gauze with a cloth, tape measure, or yardstick. Then place the tape measure behind the client and measure starting on the umbilicus. Then record the distance on designated units, centimeter or inches. Then take all future measurements from the same location, especially for noted distension. Mark the abdomen with a ballpoint pen to aid in measuring site. Ask the client not to wash the mark until it's longer needed. Next, I am going to check for symmetry. Ask the client to raise his or her head to further assess for hemation or diastasis, all bulge. Then inspect the abdominal movement where the client breathes. Observe the peristaltic waves. Okay, sir, can you raise your head for me? Okay, so thank you, sir. One more, sir. Can you inhale for me? Exhale. Now, for auscultation, auscultate for the vowel sounds. Use the diaphragm of the stethoscope and make sure that it was warm before placing off on the abdomen. Then apply light pressure on simple rest the stethoscope if the abdomen is tender or painful. Perform auscultation starting with the RLQ, RUQ, LUQ, and the LLQ. Then listen to each quadrant for 5 minutes, minimum 1 minute per quadrant to confirm any absence of vowels. Then note the intensity, pitch, and frequency of the sound. Now, I am going to auscultate for vascular sounds. Use the bell of the stethoscope to listen to bruits, low-pitched, murmur-like sound pronounced over the abdominal aorta, renal, iliac, and femoral arteries. Then I am going to auscultate for venous hum. Use the bell of the stethoscope to listen for venous hum in the epigastric and umbilical areas. Then I am going to auscultate for friction rub over the liver and spleen. Place the diaphragm of the stethoscope over the right and the left lower rib cage and listen to the friction rub. Now, I am going to percuss for tone. With the percussion hand technique, lightly and systematically percuss all quadrants. Percussion may proceed clockwise or up and down over the abdomen. So now I am going to percuss the span or height of the liver by determining its lower and upper border. Determine the lower border by percussing beginning from the right lower quadrant and at the mid-clavicular line, then upwards. Then I am going to note the change from tympani to dullness. Mark the area of dullness. This is the liver border of the dullness. So now I am going to assess the descent of the liver. Locate the liver border of dullness. Ask the client to take a deep breath. Observe for the descent of the lower border of liver dullness below the costal margin and deep inspiration, and the client hold his or her breath. Okay, sir, can you inhale for me, please? Exhale. Okay. So now I am going to percuss the upper abdomen of my client. Then locate the upper right chest at the mid-clavicular line and percuss downward. Mark the point where change from the upper right chest, lung resonant until liver dullness is noted. This is the upper border of liver dullness. Then measure the distance between the two marks. This is the liver span. Then repeat the percussion of the liver at the mid-sternal line. Then use the tape measure to measure the distance between the two marks. So the measure of it is 9 centimeter. Now I am going to percuss the spleen. Begin percussion on the posterior to the left mid-axillary line and percuss downward. Note the change for the lungs resonance to splenic dullness. Perform a second method of percussion to determine enlargement by asking the client to take a deep breath and start percussing on the last left interspace at the anterior axillary line. So, blunt percussion on liver. Ask the client to sit with his or her back to you. Then, place the left hand fist against the lower right anterior rib cage. Use the ulnar side of the right fist and strike the left hand. Then, note for any tenderness upon percussion. So, sir, can you sit down for me, please? Then, note for any tenderness upon percussion. Blunt percussion on kidneys. Ask the client to sit with his or her back to you. Place the left hand on the costovertebral angles. Repeat the step number 44 to 45. Okay, sir, can you now back to a supine position? Now I am going to proceed to palpation. Position the client back in a supine position. Cover the upper and lower body parts of with the bed sheet, leaving the abdomen exposed. Begin palpating on a non-tender abdominal quadrant. Use the fingertips to compress the quadrant to a dip of 1 centimeter in a dipping motion. Lift fingers gently and proceed to the next quadrant. Begin palpating deep all by quadrants to delineate organs. Use the palmar surface of the fingers to compress quadrants to a maximum of depth of 5 to 6 cm. Note for any resistance or any deeper structures. Perform by manual palpation if resistance or deeper structure is felt. So now I am going to palpate 4 muscles. Use the fingertips to compress all quadrants to a depth of 1 cm in a dipping motion. Then note for any muscles and its size, 2 cm, location, shape, consistency, demarcation, pulsatility, tenderness, and mobility. Now I am going to palpate for the umbilicus and its surrounding. Note for any swelling, bulges, and masses. Then palpate the aorta. Use the thumb and the first finger or use both hands to palpate deeply and assess for the pulsation. Then now I am going to palpate for the liver. Stand the client's right side. Place the left hand under the client's back at the level of the 11th and 12th ribs. Lay right hand the parallel to the right costal margin. The fingertips should point towards the client's head. Then ask the client to inhale, then compress upward and inward with fingers. Note for consistency and tenderness. So sir, I am going to put my hand in your back. Can you inhale for me, sir? Exhale. Inhale. Exhale. Okay, thank you. So now I am going to palpate by hooking. Stand to the right of the client's chest. Curl or hook the fingers of the both hands over the edge of the right costal margin. Then ask the client to take a deep breath and gently but firmly pull inward and upward with your fingers. Note for consistency and tenderness. Okay, sir, can you inhale for me, please? Exhale. Okay, so now I am going to palpate the spleen in two-way method. Ask the client to turn onto his or her right side. Then palpate the spleen by moving it downward and forward. Sir, can you face your right side? and document the size insert in centimeters below the left costal margin. Then note for consistency and tenderness. Then now I am going to palpate the kidneys. Place the left hand on the right posterior flank and provided support. Place the right hand on the right upper quadrant just below the costal margin at the mid-clavicular line. Ask the client to exhale and hold breath briefly. Gradually release the pressure of the hand. Repeat the steps for the left kidney. So, sir, can you hold your breath for me, sir? Inhale. Exhale. Inhale. Inhale. Exhale. Inhale. So now I am going to palpate the kidneys. Begin palpating at the symphysis, pubis, and move upward and outward to estimate bladder borders. Note for consistency and tenderness. So now I am going to test for the Powasi sign. Ask the client to lie on the left side. Hyperextend the right leg of the client. Note for pain and reaction of the client. Okay, sir, it is painful. Okay. Then after that, I am going to test for obturator sign. Hold and support the client's right knee and ankle. Then flex the hip and the knee and rotate the leg internally and externally. Note for pain and reaction of the client. Okay, sir, it is painful. So I am going to test for the appendicitis. Assess for rebound tenderness by palpating deeply at a 90 degrees into the abdomen away from the painful or tender area. Suddenly release pressure. Listen and watch the client's expression of pain. Ask the client which hurt more, pressing in or releasing. Ask the client where in the abdomen the pain occurred. So sir, it is painful. It is painful. Okay. After that, help the client to put back his clothes on and position the client comfortably on bed. Summarize the information obtained during the working phase and discuss findings to the client. Discuss to the client possible plans to resolve health concern if present. Assess for the client's understanding of the plan and the need for further teaching. Provide the clients an opportunity to clarify, ask or raise any concern. And thank the client and end the interview politely. Done with the aftercare, perform hand washing, and document findings in the client's record using printed or electronic forms or checklist supplemented by narrative notes when appropriate. Okay, sir, since we're done for this abdomen assessment, are there any questions or clarifications?
No.
Okay, so sir, thank you for your cooperation and have a great day ahead. So that's it for the assessment of the abdomen.